Asthma is a chronic condition of the lungs that affects how you feel and breathe. It's not contagious. You can't get asthma from someone else, like a cold, and you can't pass it on to anyone else. You can have symptoms that occur every day, weekly, every few months, or hardly at all. Some children seem to outgrow it, but most teens with asthma will continue to have symptoms as an adult. Most importantly, with the proper treatment, people with asthma can have normal and active lives. What exactly happens when I have asthma symptoms? When you have asthma, the airways in your lungs are swollen and inflamed. The airways are the tubes that carry air in and out of your lungs. When you are exposed to something that irritates the airways, they start to narrow, getting smaller with less air able to move in and out. Muscles in and around the swollen airways get tight, and more mucus is made. This causes you to have trouble breathing, with chest tightness, coughing, and sometimes wheezing, or a whistling sound when you breathe. What are the most common symptoms of asthma? Coughing, especially during the night. Will I always have asthma? Studies have shown that asthma usually does not go away, and that the swelling in your lungs actually stays there even when your asthma is not bothering you. This is important to know because you need to pay attention to how you feel, and if your breathing changes. It's true that some people only have asthma as a child, and never seem to have symptoms again. Others can have symptoms their whole lives. Finally, there are other people who have no symptoms for years, and then have it bother them again, many years later. It's important to remember that asthma is a chronic condition, which means it can keep coming back, unlike a common cold which is temporary. As a teen with asthma, you will probably have it as you grow into adulthood. Remember, asthma is very treatable, and you should be able to live a normal, healthy life, and be as active as you would like. In fact, some teens forget to mention they have asthma, or a history of asthma, to a new healthcare provider or their school nurse. It is very important to remember to tell your healthcare provider or someone else involved in your health about your asthma, and what medications you are taking, even if you have not had any symptoms for a long time. Learn the name and dosage strength of your asthma medications, as many medications come in different strengths. It's not enough to just identify asthma medications by the color of the inhaler. And always use a spacer device when